I'm Nancy Bernstein from the National AIDS Housing Coalition. To prevent and treat HIV AIDS in the U.S., we must end homelessness and housing instability for people living with and at risk of HIV infection. A large body of research findings shows that housing status has a direct, independent, and powerful impact on HIV incidence and on the health of people living with HIV AIDS. Whatever factor makes someone vulnerable to HIV infection, homelessness magnifies the risk. Whatever factors lead to disparities in care for women, for youth, for sexual minorities, for people of color, for those who experience mental illness, addiction, violence, abuse, or incarceration, housing instability amplifies these disparities in tragic and avoidable ways. Despite relatively easy access to ART, the ongoing 30-year AIDS crisis in America is marked by stalled prevention efforts and worsening HIV health disparities, inequities driven by poverty, place, and other social factors often considered too complex or costly to address. Housing instability, however, is one significant social driver of HIV health inequities that can be addressed by investing in proven housing interventions, including effective low-threshold housing models for active drug users. Rigorous studies show that housing supports improve physical and mental health, reduce behaviors that can transmit HIV, and sharply cut public spending on avoidable emergency room visits and inpatient care. The healthcare savings realized through prevented HIV infections and reduced reliance on crisis care offset all or part of the cost of housing, making housing assistance a cost-effective HIV prevention and care intervention. Despite these facts, HUD reports that over 145,000 U.S. households living with HIV have a current unmet housing need. It is time to scale up proven HIV housing interventions to meet real need. One barrier to progress is the disconnect between those who pay for health care services and those who implement structural interventions that reduce illness. Accurate budgeting methods would dissolve these silos and cut across cost centers to reflect the fact that much of the public savings from housing investments occur in public health and medical spending. We call on PACHA to take the lead in making housing a central component of the U.S. response to HIV/AIDS.
Thank you.